Hey everyone, welcome back to my channel. It's Dr. Alessandro, and in today's video, I'll be speaking with you about dental trauma in part one of a two-part series. Now, this first part is actually dedicated to the more medical side of the situation. Dental trauma can happen in a whole bunch of different ways, from your motor vehicle accidents to your sporting accidents to sledding or playground type of accidents. So there are all sorts of ways in which dental trauma can occur. But here's the most important takeaway from this first video. If you do anything at all, the first stop, if you have a situation where, say, a person loses consciousness after head and neck trauma, or there are very significant facial injuries like lacerations, or burn marks or anything like that, the first stop is not the dental office, it is the ER. Please make sure that, especially if there's loss of consciousness, that the brain is working well, that there's no brain injury, that there are no other injuries that need to be tended to, that a general dental office may not have the right materials and equipment and personnel to handle. So if there's something really serious that involves the head and neck, please go to the ER first, make sure everything's stable, then make sure the second stop is the dental office. Now, some ERs may have a dentist on call or some sort of a dental contract, so they may be able to help you out with dental injuries. Some, not all. But if they do, that's great. If they don't, then at least make sure that they try to provide some sort of basic wound care for dental injuries. Or in the case of teeth being knocked out, that they have some idea of how to preserve them, and that way potentially they can be replanted or put back in. But in any event, again, for serious injuries, go to the ER first. Don't stop at the dental office first. We want to make sure that the person's health, brain health, body health, and everything else is stable and well before we are able to take care of them on our end. So again, thank you so much for joining me on this video. I appreciate it. Thank you so much for continuing to join me in my video series. We'll discuss part two, and I'll show cases of dental trauma to you all in part two, and hope you're all staying well and healthy.